Joining us now, someone who will be affected by this bill. She's Army veteran Amber Barno, who's a spokesperson for Concerned Veterans for America. Amber, as always, it is good to have you with us. Thanks for Skyping in from Washington, D.C. today.
Thanks for having me. It's great to be back.
So, Amber, what do you think about this compromise? Roger Wicker says, well, hey, look, you've got people far apart. They got it together. Is this the way Washington is supposed to work?
Well, I do think that it's good news coming out of Washington for this VA Reform Conference report. It is nice to see members of Congress working together. Compromise was involved, so there's definitely some good sides of this bill mixed in with some things that we definitely don't think that was needed in this bill. But for the majority of it, it is going to help veterans, so we're happy that they could come to a compromise, and hopefully it will move across the president's desk here shortly.
And that's what everybody's hoping. But Amber, I wanted to ask you about that provision which allows veterans to see private physicians in certain circumstances. This is something that you have said would help in this situation. Are folks happy about this, and do you think it will have a different effect, maybe giving the VA Medical Center a little bit more motivation to take better care of vets?
I do. The two positive things out of the bill is the accountability part, and that veterans are going to be able to seek privatized health care if they have an appointment time that's outside of the 30-day window or a 40-day mileage radius from a VA facility. So that part of it is great, that veterans will have that option when the VA is lacking on performance with their appointment times or locations for facilities. Veterans will be able to seek healthcare elsewhere at the dime of the VA because the VA wasn't able to perform in that aspect. But the part I don't like about that is the stipulation involved that it only applies to veterans who are enrolled in the healthcare system by August 1st of 2014. So there's this stipulation that says if you've had to deal with the problematic part of the VA, then okay, you can now have this good part of the VA bill that's going to be passed. But if maybe you had other choices and you didn't have to use the VA system, you'd heard about how terrible it was, and you were like, I don't want to allow myself to that sort of treatment, those people aren't going to be eligible for this privatized healthcare option.
You know, Amber, the bill would also allow the VA secretary to immediately fire senior executives. Do you think this is a good stopgap to stem the corruption we've seen, or do you think it could also lead to favoritism, political favoritism, that sort of thing?
No, I think that aspect of the bill was absolutely mandatory. The VA doesn't have a funding problem, it has a culture problem. And part of that is not being able to fire those infected leaders, those corrupt managers who are making very poor decisions that veterans are suffering the consequences of. So that's like stop number one that needed to be in this piece of legislation. They need to make sure that the Secretary of the VA has the authority to make the decision to fire those managers who are really making the culture within the VA bad for everyone.
Amber, as we hear about this compromise and that the Secretary can fire these managers, what about specific case workers or mid-level folks? As part of the compromise, protecting the, quote, workers' rights, the union rules that some of these people live under, was that mixed into this compromise?
The main thing that this piece of legislation is going after is the senior executive services employees, the SES employees, where those are the ones where it is literally impossible to get fired. It's almost about a 2-year process where you're still getting paid, you're still getting basically all of your employee benefits, and oftentimes you are writing your own self-evaluation reports. And so it takes 2 negative evaluation reports within a year to even get that ball rolling to get fired. So that's why it was so crucial that these SES employees were actually rolled in on this accountability part of the bill. It's easier for the lower level employees that don't have as much tenure or basically the seniority of those SES employees.
You know, one of the things about the bill that I really liked was the expanded scholarship program, that it's now going to include the spouses of people that, you know, died in the line of duty, and also that now all vets will qualify for in-state tuition. What do you think of these measures?
I think that it's a good thing. I don't think it was actually something that there needed to be time focused to. This was to fix the VA healthcare problem in terms of these long wait times and veterans dying at the hands of decisions at the VA and their ineptness and inability to manage the system. So I think that that was something that was thrown in. I think that had a little bit more of playing politics is involved. They were just throwing some stuff under this piece of legislation. I mean, it's fine, but once again, it's more money. It didn't have anything to do with the healthcare part of the problem, which was the dire situation here.
Now, Amber, is that something that you feel like members of the House GOP conference should hold their feet on? We've talked about the concerns about the price tag involved in this and some of the other measures that tend to get added onto these types of bills. We want to see this pass, of course. We want to see the VA get the help that it needs. But on those issues you just raised some concerns about, should some people say, wait, we don't need that stuff, we should really just focus on the task at hand?
Well, I think it goes back to what we talked about in the beginning. There's going to have to be compromise involved, you know, to maybe like squash the big problem here. We are going to have to deal with some of these smaller issues being thrown in, which I think is acceptable. But it just comes back to that funding is not the issue. The CBO has said that it's possibly going to cost around $17 billion over this 10-year time period. 10 of that is going to the private healthcare option for veterans. About 5 of it is going to hire more staff and doctors and different medical staff. And then a little over $1 billion is going to go to new leasing, new VA facilities. But what this comes down to is, once again, this is not a funding issue. The VA funding has increased almost 60% since 2009. They have the funding, they have the money available to them. They don't have the managers properly allocating it to the right positions. And part of that is because of the bureaucracy and the red tape that doesn't allow them to shuffle where it's needed versus where it's going. So I think this is giving the VA a free pass, essentially, with them not managing their finances very well. And it's just saying, here's some money, fix it real quick, but you're not having to address your inability to manage your money very well.
In fact, Amber, as I understand the legislation, there's $2 billion that is authorized to go to, quote, miscellaneous spending, which may be in one sense something very desirable in the abstract, like opening up scholarship opportunities. But miscellaneous, in one sense, a lot of people are going to say, wait a minute, this is a bridge too far, and yet the compromise situation. On balance, Amber, are you satisfied with this? And would you advise members of Congress and the U.S. Senate to vote for it?
I think that I agree with the majority of what the bill stands for and what it's going to do for veterans. It's not perfect. I don't think that we will ever have a perfect one that actually gets to this far, where it has as much support as it does. So right now, yes, I support it. I think it needs to pass. It's going to help veterans. And I think it will, in the big picture, it's going to do great things for the VA because of that accountability piece that's in there with the top level managers and because of the private healthcare options.
Well, we can't really understate or overstate, I guess I should say, the importance of this private workaround. And a lot of folks might be lost, Amber, on the idea that this is a socialist, Bernie Sanders, a self-identifying socialist, advocating for a private sector workaround when it comes to the VA here. And if there's enough money in this plan, maybe more doctors will also offer up some volunteer hours to help contribute to the backlog.
And it also covers veterans that are more than 40 miles away from a VA hospital. So that's important as well, because some of these people don't have access.
Yeah, and you know, Jade, go ahead, Amber, sorry.
No, I was going to say exactly to your point as far as government-run healthcare and the environment and culture that goes along with it. We need these doctors to be working past 3 p.m.
Right.
You know, we need them to be doing their jobs and actually not being part of that bureaucracy problem. And once they've been there for a few years and they understand how the system works, they're actually still doing their job as doctors and basically treating the VA more as private healthcare. And actually getting in there and doing the work and not basically just getting used to that bureaucracy and getting comfortable in it and being like, oh, I'm clocking out at 3 o'clock instead of staying and ensuring I get to see more patients, more veterans, and helping the situation instead of being part of the problem.
Exactly.
Well, Amber, Barno, you always do a great job taking a look at these different proposals. We thank you both for your service in the United States Army and your time with us today. We look forward to visiting with you again real soon.
Thanks for having me.
All right, stay with us. When we come back, midterm races around the country. Where are candidates lining up? Larry Sabato from the UVA with his crystal ball next.